hospitals and inpatient rehab facilities just cried foul and said they were, getting all of these requests and they were being overwhelmed and they were so aggressive and they were just looking for these reasons to deny claims so that they could collect their contingency fee on each claim. The permanent program does have some safeguards to protect against what were some of the perceived abuses, limiting the number of record requests that they can make and how far back in time they can go. So I think that really will help deal with some of those issues that the providers raised in those trial states. I think we can move on then to the Medicare coverage requirements. And this came about because last fall, the OIG issued a report. And the report was about whether these claims in nursing homes met Medicare coverage requirements. And we all thought, well, they're going to go into these nursing homes and look at these claims and see whether the patients are eligible, whether, they have these long lengths of stay or these ill-defined diagnoses. And the OIG took a kind of a surprising turn. They did not look at eligibility at all. They went and did something very shocking. They read the law about what it is that you need to have have your claim, a hospice claim covered by Medicare. And so what they did, going to the next slide, is they looked at 450 claims. And they found that 82% of them did not meet at least one of the Medicare coverage requirements. And what a Medicare coverage requirement is, in short, is something that needs to be met in order to be paid. And so what they don't come right out and tell you, but what we are shocked about, is that technically that means those 82% of all hospice claims they reviewed should not have been paid. And that claims for not-for-profit hospices were actually less compliant than claims for for-profit hospices. And so right now you might be wondering, what are these Medicare coverage requirements? Because that's not the way that we're used to medical review. We're used to our intermediaries talking to us about eligibility. And what are these coverage requirements? Well, we set them forth. They're found in 42 CFR 418.200. And you'll see there a list of them. For example, a certification that the individual is terminally ill must be completed as set forth in 42 CFR 418.22. Well, what's important there are those underlying cross-references, because not only did the OIG look, well, did you have a certification or did you have a, notice of election, but did they meet each of these specific requirements that is listed in that particular regulation? So, for example, the plan of care. Did the plan of care meet the requirement in 42 CFR 418.56 that is established by the whole interdisciplinary team and, has a signature on it from each person in the IDT? And they also looked at something that hospices are not used to having people review, which is whether the services provided were consistent with the plan of care. So if you called for a home health aide visit 3 to 4 times a week, and you only provided 2, and there's no documentation of why you didn't provide the others, that then did not meet that particular coverage requirement. And that is something that hospices have not been used to anyone looking at their plan of care or whether the services were consistent with them. And those are the ones where, not surprisingly, most of those failures to meet the coverage requirements came from. So CMS responded and said, all right, we'll let our Medicare contractors know about this report. They really didn't seem too worked up about it. And actually, most people we talked to, no one else seems to have picked up on what we think is really significant about this report. So it's possible, we're just crazy, but it's possible that one of these contractors, possibly the RACs, because they clearly have an incentive to find claims that are not payable, and they're not wedded to the style of review that our intermediaries are. So it's possible that one of them is going to pick up on this and really start looking at these issues. And so it's not like hospices are, left stranded here. There are things we can do to go take a second look at the coverage requirements, read through them, read through all those cross-references and say, are we sure we're meeting this? Not just that our intermediary has never raised a problem with whether our notice of election is compliant before, but let's really think about what might it be in here that we need to modify to make sure that no one, even if it's someone outside the intermediary like the RAC, is going to take a look at it and say, nope, you didn't meet it. So that's what we really think, again, on the future, and I'm sure many of you are actually in the middle of an ADR nightmare right now and are thinking, oh, I can't even deal with that. And it's not something you need to worry about, we think, for your current ADRs. But it's something to be aware of, and we really hope that you can take that second look, that critical look, because these requirements are so important for getting paid. You know, we can debate a lot about eligibility. There's room that's, you know, to some extent a subjective determination. But these things are really, they're written in black and white, and CMS has not imposed them as stringently as they could, but that's not preventing any of these other new contractors from doing so. So for what it's worth, that's what that is. And I think we have some time for questions and comments.
Ben, if you could give the instructions, that would be great.
Thank you. The question and answer session will be conducted electronically. If you would like to ask a question, please do so by pressing the star key followed by the digit 1 on your touch-tone telephone. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. Once again, please press star 1 on your touch-tone telephone to ask a question.
And while we're waiting, Ben, we did get a couple of questions in writing, so I'd like to ask Mary and possibly Meg also to answer the first one, which is, good news, we won our ALJ hearing. When can we expect our claim to be paid? Mary?
Well, that is great news. In terms of the timing, it's not as fast as you necessarily would like, but I can point you to some resources where you can at least check on what the status is. And it's what happens after an ALJ decision is that the ALJ's office gets together their decision, and then they send it over to this yet another contractor that's known as the administrative QIC. And they're currently known as Q2A, and their website is www.q2a.com. And what you can do when you go there is enter your appeal number and see where it is in this process. And it's not a very detailed description, but it does allow you to see, oh, our decision has been forwarded to the administrative clerk, or, oh, it's been sent back to our intermediary for effectuation. You should, the intermediaries are supposed to effectuate the decision once they receive it within 30 days. And if you notice that it's been a while, you should definitely contact your intermediary. It is definitely possible that things got mixed up along the way, and we've had to deal with that in some circumstances.
Thank you so much. Ben, do we have questions in the queue?
Currently, we have no questions at this time. Okay,
then we're going to take another one of our written questions. This has to do with the Medicare Appeals Council, and the question really is, this apparently is a less successful ALJ hearing, and so the questioner wants to know whether they should appeal to the Medicare Appeals Council.
Well, it's a good question. We traditionally in hospice, there's never really been going much beyond the ALJ hearing. And that was true for a number of reasons, not least of which were regulations which really limited the reasons that we can proceed past ALJ. What happened in 2005 was those regulations were changed, and so technically those legal barriers are now gone. What we have seen, unfortunately, is that practically the appeals we have seen go to the Appeals Council for hospices have not been very successful. I don't think that means never try it. I think it means evaluate the cases, understand what's at issue, and how much is the claim worth. Because you might want to have an attorney take a look at that and help you out with that process, and that will add to your costs in determining whether you want to pursue that or not.
And this is Meg. The barriers that we're talking about is well, not maybe as specifically limited in this way, is that oftentimes they're looking at, well, is there an error of law? Did the ALJ make a clear misapplication of the law or clearly overlook something? And so typically you can't just